Hi everyone, it's Dr. Mo. I hope you're well. Welcome to my channel. Now there's been a lot of talk in the news about coronavirus. Whenever we hear about the coronavirus on the news, and let's be honest, what else do we hear about these days? There's a lot of talk about how our hospitals and our ITUs are going to be pushed to the absolute limit. At the same time, there's always talk from the Prime Minister about increasing the capacity in hospital and increasing the capacity in ITU. As a junior doctor working in London, I wanted to talk about a few of the changes that are being made to try to increase the capacity in our hospitals. Now, there are changes that are going to affect our lives as doctors, and there are changes that are going to affect the structure of the hospital as a whole, and I'm going to talk about these two things in turn, starting with the changes that affect doctors. Now, as doctors, especially as junior doctors, it is very important for us to rotate between different specialties. My first rotation was psychiatry. At the moment I'm doing surgery, and on the 1st of April I was due to change over to be working in a general medical ward. Now on the 1st of April, it wasn't just myself or people at my level of training that were due to change over, but a large proportion of junior doctors were due to switch rotations at the same time. Now there's been a decision that no doctors will be rotating at the start of April, and that's to make sure that we're in a familiar environment as we get a huge wave of new patients coming in with the coronavirus. Whenever there's a changeover, people have to learn new skills. They spend a lot of time doing inductions and familiarizing themselves with the new environment. So the idea is that if we stay in the same place that we're familiar with, we'll be able to carry on our job much more smoothly without having to attend these inductions and without having to acclimatize to a new ward or a new team, for example. Now, as I will be staying on my surgery rotation, there are a few changes that are going on in surgery. First of all, they're going to cancel all elective and non-urgent operations. Now, not only does this free up the surgeons so they can help out on the wards, so they can help out in A&E, which is going to be really stretched over the coming few weeks. Now, this also frees up a whole host of other resources. So when you're not having operations, the anaesthetists that would have had to be there are now free. You also have ventilators available that you would have needed to support that person while they were anaesthetized. And you also have the physical space, which is the surgical theatres and also the recovery rooms that patients are taken to afterwards to wake up from anesthesia, and all of that is being freed up to make it available for any new patients coming in with suspected or confirmed coronavirus. Another change within the surgery department is that we're now being merged into one team. The old system had lots of different teams where each junior doctor, like myself, is assigned to one consultant, and you'll work with that consultant when they're very busy, when they're on call, and you're still working only with that consultant after you've discharged lots of patients. And let's say you have 1 patient left or 0 patients left, you're still assigned to that team. But that system was quite inefficient because there are times where you're very busy and times where you have more free time. At the moment, the decision they've made is to merge all of us into one big team, so we're always dealing with a roughly similar number of patients. And what this means is that you have a few people looking after the surgical patients, maybe at the start of the day into the early afternoon, and once those patients have all been seen, they all have plans. You've acted on those plans. Those same doctors are free to help out elsewhere in the hospital where they might be needed more. Now, this might be A&E or wards that are dealing with a high quantity of patients. They've also cancelled all teaching that is not on the topic of coronavirus. What this does, again, is free up our time. So instead of spending these many hours a week attending teaching, we can be spending that time dealing with our patients and dealing with the large quantity of patients we now have. Now, we've heard in Italy how doctors, like surgeons, are being trained on giving non-invasive ventilation so they can help with these patients with the respiratory symptoms, and the same thing is happening here. There are training sessions arranged that we can attend where we are taught how to use non-invasive ventilation so we can help out with these patients as and when they come into hospital. Now, we're all being told that this is a marathon, not a sprint. That's why I'm glad there have been a few well-being measures to make sure we don't burn out over the coming months. One of these is that we're still allowed to take annual leave, which is a huge relief. There was a worry that they were going to cancel annual leave, they were going to force us to stay in hospital the whole time, but there's been a decision that, at least for the time being, at least as I'm filming this, we are all allowed to take our annual leave. So when we have breaks from work booked, we can still take those and use that time to recover. Again, in the spirit of maintaining our well-being and keeping up staff morale, preventing burnout, there has been a new well-being centre in my hospital that should open today, and this has free hot drinks, free snacks, a place to relax for a few minutes whenever staff are feeling overworked. So those are the changes that will affect doctors, and there are also some structural changes that are going to happen within the hospital to make everything more efficient. First of all, the A&E department has been segregated into two different streams. That's a respiratory stream and a non-respiratory stream. As soon as patients walk through the door of A&E, they're asked a few questions about their symptoms, and if they have any symptoms of suspected coronavirus, which includes a cough or a fever, then they go into a separate respiratory side of the A&E department. And this is all to prevent mixing of these patients and to try and minimize the risk of infection between patients. What it also does is it instills in the doctors the preventative measures like wearing of PPE, and it makes it very clear to us when we're dealing with a patient with suspected or confirmed coronavirus and when we're dealing with someone without any symptoms. So there's no confusion about which patients do we need to wear PPE, which patients do we not need to wear PPE. As long as you're in that part of the hospital, you should be taking the same precautions with any patient that you see. Over the last week or two, there's been a big push to discharge patients whenever it's safe to do so. I'm sure this is going to continue over the coming weeks as well. And what this does is not only does it free up beds that we can use to take in new patients with suspected coronavirus, but it also means that when someone's been on ITU, they've been ventilated and they recover, they improve, it means there is no delay to get them off of ITU onto a normal ward bed so that the ITU bed becomes available to someone else who needs it. Otherwise, there might be scenarios of people improving on ITU, no longer needing ventilation, no longer needing the specialist ITU care, but then taking up that bed until another bed becomes available on the hospital. Now, by having that push to free up as many beds as possible, the aim is to minimize that bottleneck, so anyone who doesn't have to be on ITU doesn't have to be. There's also been a wide redistribution of resources. So for example, I work on surgical wards, and we recently had boxes arrive of surgical masks. Now, they're not crucial on our surgical wards. They're important when you see someone with coronavirus to wear these masks. But the surgical wards are not designated coronavirus wards, so even if someone did test positive on one of our wards, the aim would be to move them to a designated coronavirus ward as soon as possible. So what happened actually with this box of masks is that it was taken back and sent somewhere where it was needed more urgently. Now, to minimize the spread of the infection, there have been limits on the number of visitors. So at the moment, each bed can have a maximum of one visitor at any one time, and this is being enforced pretty strictly. And there are also talks of even stopping all visitors to the hospital, except for exceptional circumstances like palliative patients or patients that are actively dying, which need to see their family. Now, another change within the hospital is that there have been guidelines developed for coronavirus and non-coronavirus wards. So like I said, the surgical wards that I work on are going to continue operating as non-coronavirus wards, but there have been special guidelines developed by the hospital and by Public Health England for how to deal with coronavirus patients on their own segregated wards. And this includes things like having different zones. So for example, the bed that the patient is in is designated a red zone. As you step out of the room, there is an orange zone, and then there's a green zone even further away. And at every one of these zones, there are different precautions that you can take when stepping in. There is a different order that you take things off and wash when you're stepping out. So all of these guidelines are being developed and updated with the latest evidence. And there have also been guidelines on transferring patients with suspected or confirmed coronavirus. As you can imagine, you don't want to wheel someone down a corridor packed full of people when they have this infectious disease. So for example, at the moment, whenever you want to transfer someone from one ward to another, the whole corridor is blocked off, so there can be no visitors, not even any staff members in the corridor during the transfer, and the transfer is accompanied by a few especially trained members of staff, and this is all to minimize the infection risk. Thanks for watching. I hope you found that interesting. If you did enjoy it, please like the video, it helps out a lot, and subscribe for more videos like this, and leave a comment down below. What else would you like to know about my life as a doctor and how it's being affected by the current coronavirus situation?